Hi, I'm Dr. Justin Varney. I'm the Director of Public Health for Birmingham City Council, and I'm here to talk to you about the active system component of our new public health physical activity strategy that we're working on, and we want your opinions on. So what is an active system? Well, an active system is the idea that by creating a more connected system across our city and getting people to work together, to having stronger leadership, clearer governance, working in partnership to develop our workforce both in public sector services but also in the voluntary and community sector, that we will create an environment in which it's easier for us all to be active every day. And we know that physical activity is important in so many ways across so many different health conditions, but also it's important for children's education. It's important for the economic sustainability of our high streets. So creating a system which works towards that is really, really important. So just drilling down a bit more into what is this priority about? Well, the first level of this is it's about having coherent leadership. And that's not just leadership by the city council, it's leadership in partnership across the city. Creating a city in which everyone is active at every day and in every way that works for their ability means all of us need to step up into leadership roles and work together in this space. It's about creating a system in which organisations work together to make the change. And often in our city, there are lots of things pulling us in different directions, different priorities. But actually having this as a clear shared vision and a shared approach is really key. Giving professionals the skills to be able to talk about physical activity in ways that helps people is a really good example of something that if we did it across the system effectively, so that when you saw your nurse in GP practice or you spoke to a pharmacist or you were working with a social worker or a teacher in a school, all of them have got that basic training to understand how to motivate people to become physically active and how to make a difference. So it's not about lecturing you, it's about working with you and helping you become more active every day. And it's also about making sure that as a system we monitor whether this is making a difference. We're great at writing documents, but if we don't have a way of monitoring what's going on, then we're really not going to make a difference. And we're never going to know what works. So some examples about what this might look like in practice. So in terms of what we would want to improve, strengthening our coordination and joint up working with partners is really fundamental to creating an active system. We have a Creating an Active City forum at a city-wide level, but one example of how this could work is we could develop 5 locality forums. We could take them even lower and think about, should we have active ward forums to help people in local communities work together to make the most of the environment that they have and help people become active every day. Increase the knowledge and skills of people working across our system to help people become physically active. Now, we could talk about that in the context of healthcare professionals working with people with diseases and illnesses, but we could also talk about it in the context of people working in human resources in businesses, where we know actually helping people to be physically active in the workplace during working hours does take skills and expertise. So it's across the whole system this needs to come to life. And then finally, monitoring how we learn about what's happening. How do we see whether this strategy is actually working? Or is it a strategy that's saying the right things but not actually going into action? So monitoring it and really keeping an eye on whether we're making a difference is a really important part of having an active system. So what's the ask of you? Well, we've written a draft physical activity strategy. We've done it in partnership with many organisations across the city. We've heard from focus groups that we've done with people that don't normally engage with us in helping to shape this and bring this strategy together. But now we want your thoughts. That's what this consultation is about. We want to create a movement for change, a movement for movement in Birmingham. So this is your chance to have your say. Tell us what you think about these priorities. Are we missing a point? Is there something else we could do? Have you got some ideas to play into this? Have your say. Use the Be Heard questionnaire that's available at the end of this video clip and help us move towards becoming a more physically active city, a city in which everyone at every ability can be active every day for the whole of their lives. Because physical activity truly is a wonder drug and really can make a difference to people. We just need to create a city in which it's the easiest, most efficient, affordable, and safest thing to do so that all of us can benefit and live longer, healthier, happier lives.